Thank you all for your participation and for your presence for today's webinar. As you can see on the screen, today's webinar is on digital health innovation to engage and empower. And we will be having two speakers for today's webinar who will be speaking on this topic. Dr. Harpreet Kaur, she's a faculty Department of Online Education at Power School of Health. Dr. Rinsa Wahid, Faculty Department of Online Education at Power School of Health. This session will be for 1 hour, and the recording, since this session is live on Facebook, so if you and your friend would like to see it again, they can visit our Facebook page. The link will be posted on the chat box. The certificate of participation will be provided to all post-webinar within 24 to 48 hours. And at the end of the presentation and speaking, there will be a Q&A session for 10 to 15 minutes. So I would request you all to please note down your questions, and those can be posted on the chat box. And this webinar we are doing in collaboration with Pharmaceutical Society of Zambia, one of our partners. There are a few housekeeping announcements for participants. Please mute your mic and turn off your cameras. As I mentioned, there will be a Q&A session. So if you have any question, you can put it on the chat box, and that will be answered during the Q&A session. There will be two polls. Just for a few seconds, so we need your engagement over there. Participate in the poll, so it will give us the idea about the audience. The recording will be available on Empower School of Health YouTube channel. I'm so sorry, by mistake it's written over here, the deck will be shared. The deck will not be shared due to some limitation that we have, but the recording is available. And I would request all participants to please participate in the polls. There are a few announcements for speakers. Please turn on your cameras for better engagement. Please mute your microphone when other speaker is speaking. Please adhere to the webinar schedule timings. Now this is the time to launch poll 1. I can see we have almost over 130 participants for today's webinar, so I request you all to participate in this poll. Over here, there are basic questions about your background, your geographical region, your academic background. How did you hear about us? So it will basically give us an idea about our audience. So we will live this poll for a few more seconds, and then we will show the results for all. Thank you. I can see percentage is increasing, but still more than half of the audience to be participated in the poll. You just need to select the respective answer in front of the question and submit your polls. That's all. 45% of the audience have participated, still 55% left. The certificate for this webinar will be sent on the registered email ID. That will be provided directly, will be sent it to your registered email ID with your name and everything. I'll show you the sample how this will look like. We'll wait for 15 more seconds and then we will close the poll. Let me just give you a brief idea of how the poll is looking like. What is your gender? The maximum gender, the audience we have from male background and 37 from female. What is the age group? Maximum attendees between 30 to 40. Okay, so we have 17% from West Africa as per the geographical region and 53% elsewhere. About the academic background, we have maximum 34% from pharmacy diploma and bachelor's degree. Then how many work of experience? I can see there is a, mix and match about it. So it's over here. I can see 30% above between 5 years, then 6 to 10 years, 28%, 11 to 15 years, 20%, and over 15 years, that is 22%. Which sector you're working? The maximum 31% are from NGO and 22% national government. Okay. What is your area of work? Supply chain, I can see that is 37%. And what type of organization you work? 35% hospital clinical. How did you hear about us? 85% I can see Empower School of Health. email, and then Empower Social Media, and then Pharmaceutical Society Zambia 2%. Thank you all for your participation. I would request others to now we will move on to next slide. Now I would like you to be introduced with first speaker for today's webinar, Dr. Harpreet Kaur. She is a trained anthropologist with PhD in demographic and biochemical genetics from University of Delhi. She has been engaged in design, development, implementation of digital health research projects. She dedicated her expertise to various critical areas, including maternal child health, non-communicable diseases, sustainable development goals, digital health intervention. Uh, Her commitment further extends to mentoring interns, serving on research advisory board, and judging hackathons, poster presentation, etc. And as you all know, she is currently a faculty with Empower School of Health and one of the major faculty for digital health course, which we have recently launched. Over to you, Dr. Harpreet. Thank you all.
Thank you. So let's begin with today's session. May I request you to please move on to the next slide. So to begin with, I think everybody should first of all have a clear understanding of what is digital health. So let us break down this term in order to have a clear understanding of its key components. So as per the Merriam-Webster dictionary, digital is something which is composed of data in this form of specially binary digits, either it can be represented in form of 0 or 1. And the examples may include digital images, a digital readout, or a digital broadcast. And then what is health? So as per the World Health Organization definition, health is a state of complete physical, mental, and social well-being, and not merely the absence of any disease or infirmity. So next slide, please. So this leads us to a combined understanding of what is digital health. So digital health is the systematic application of information and communications, technologies, computer sciences, and data to support informed decision-making by the individuals, by the health workforce, and by the health systems in order to strengthen the resilience towards disease and to improve health and wellness. Next slide. So what does digital health encompasses? So digital health includes all the concepts and activities that lay at the intersection of health with information and communication technologies, such as, it may include e-health, m-health, telehealth, telemedicine, electronic health records, machine learning, artificial intelligence, blockchain, Internet of Things. So let us discuss some of the key subdomains of digital health. So what is e-health? So e-health refers to the cost-effective and secure usage of information and communication technology to support health. Then comes mobile health, or more popularly known as m-health. It refers to the front-end client-facing applications, the mobile health apps that we all have on our phones, and other services that use mobile devices. Then comes the electronic logistic management information system, or ELMIS. So this system stores and aggregates normal supply chain data, and it allows for analysis to improve the supply chain management. Then comes the telemedicine, which is the provision of healthcare services over a distance using ICT for diagnosis, treatment, prevention, research, evaluation, and for continuing the healthcare education. So telemedicine may be either from a client to provider to a client, or from a provider to provider. Then comes the lab information system. So lab information systems are generally softwares which are used for recording, managing, and storing data for clinical laboratories. The last one is the health information systems, or HIS. So it is a system that integrates data, gathering of data, processing of data, reporting of data, even visualization of data in order to improve health service efficacy and efficiency and it helps in better management of all the facilities at that level, and thus, leading to an enhanced healthcare.
So, as we all know that when scaled up, digital health can be a strategic tool for expanding universal health coverage, which is one of the key mandates of many governments. So, throughout this process, digital health has the ability to achieve the following benefits. So, for example, number one is driving demand and improving access. So, telehealth can enable remote healthcare delivery while health promotion, with health promotion campaigns that can encourage clients to seek care. Second is increasing accountability. So it can enhance accountability by using health management information systems like we just discussed in order to justify the policies that have put the systems in place and other interventions. Next is ensuring protection from health costs, which is one of the key domains, affordability of healthcare services. So health promotion messaging or texts, can be sent to patients, which can help them in preventing their illnesses, can help them further with, guide them through hospitalization, thus reducing their health expenses. Next is enhancing quality and improving efficiency. So digital health applications can offer clinical decision support systems. Our decision support system is where it is based on an algorithm which helps you decide for a certain thing. So they can be there to enhance the patient outcomes or provide clinical knowledge in locations that have limited resources. Next is improving supply of service. So the logistic management information services, they can be utilized and they can assist with planning for adequate resources that are required at various healthcare institutions. Next slide. So this slide is for the digital health stakeholders. Whenever we are planning for an enabling environment for implementation of a digital health policy, it is very important to consider a wide range of stakeholders. So without the collaboration or coordination amongst these primary stakeholders, the digital health cannot be implemented for a certain region or a certain country. These stakeholders include non-governmental. Okay. These stakeholders include non-governmental financing sources, non-governmental organizations, technologies, businesses, supply chains, and logistic teams, technological structures, healthcare providers, end user, and other advocates. These are all significant stakeholders in case, we have to implement a digital health policy. But in center of these stakeholders lies the Ministry of Health, who is primarily responsible for managing a country's digital health profile. Next slide, please. So let us look at the 7 building blocks, which are an essential component for the enabling environment for digital health. So let us first see the leadership and governance. It is on the top. So it sets the course and vision for a particular region or a particular country, and it organizes the people that are working within it. Next comes strategy and investment. It turns the leadership and governance into action and also addresses the financing issues. Next is services and applications. So it constitutes the digital health applications and other services that are being delivered to clients. Next is standards and interoperability. So it facilitates communication between a group of applications or between various applications and other digital health platforms. So interoperability is a key prominent issue, even if region wise we have separate apps for a certain thing, but if the data is not, it is not based on the principles of interoperability, it will be difficult to share data, to analyze data, to draw a comparison amongst the variables that are engaged. Next is infrastructure. Infrastructure includes the physical devices, and the telecom networks that are required for service delivery. Then comes the legislation, policy, and compliance, which are very essential in order to implement a digital health policy. Then comes the workforce. So workforce is one of the key components, and it is very important, to enhance the capacity of the workforce who is going to, primarily utilize the digital health interventions so that a better outcome can be achieved out of this. Next slide, please. So now let's discuss about healthcare revolution. The kind of healthcare system that we see today, it was not same a couple of decades ago. So there has been a kind of healthcare revolution which was concurrent with the industrial revolution. So as you can see this picture, as well as the industries progressed from the era of agriculture to industrialization, the first phase was driven by technologies such as the introduction of steam engines, of sewing machines, and it gradually moved on to the second phase of introduction, where electricity was one of the prominent feature, the introduction of electricity, which led to shift to mass production of goods. So key technologies of Industry 3.0 include computer integrated systems, flexible manufacturing, ERP systems, and gradually the industry evolved to the fourth industrial revolution, which is further characterized by integration of cyber physical systems, Internet of Things, cloud-based operations, big data, artificial intelligence. So while the industries were, moving from, they were evolving gradually from one phase to the other phase, parallel to it, healthcare was also evolving. So healthcare revolution occurred. Let's discuss it phase by phase. So for healthcare 1.0, there was a very physician-centric approach. So here in the clinical team, they led to the processes, and but the major challenge that they faced all the time was a standardized record keeping and over reliance on manual processes. So this ultimately led to inefficiencies or some mistakes. So moreover, there was an absence of preventive care. The vaccinations were not that much developed. So this often resulted in late stage diagnosis and also to the costly treatments. Next stage came for Healthcare 2.0, which witnessed numerous developments in medical equipments and devices, including, imaging test equipment such as MRIs were introduced, ultrasound came into picture, CT scans were there. Then there were monitoring devices such as pulse oximeter, arterial lines, and other surgical and life support equipments also came into being, such as chest tubes. So this all facilitated diagnosis, treatment, monitoring of the patients. Then came Healthcare 3.0. So Healthcare 3.0 introduced electronic health records, or EHRs as we more popularly call them. So this all revolutionized the record keeping and diagnostic procedures. And it also emerged with a personalized and holistic approach. And this era utilized advancements that were going on in the fields of genomics, in the field of data analytics, and the connected devices to tailor treatment of the individual patient needs. This era also saw a significant rise in telemedicine, which led to improvement of access to health services, particularly for those who were in remote or rural areas. And a major development of this phase was there were improvement in interoperability among health systems, which further allowed for seamless sharing of patient data across platforms. So the last stage was Healthcare 4.0, which aligned itself perfectly with the principles of fourth industrial revolution. It started integrating digital health, physical health, and biological systems in a seamless manner. And it significantly worked on empowering patients through technology. This era saw the healthcare delivery processes evolving into a cyber physical system, And it also utilized the integration of technologies such as Internet of Things, RFID. We have wearable devices. There were other medical devices. Intelligent sensors were introduced. There were medical robots who could do, assist with the surgical procedures. So these were integrated with cloud computing, big data analytics, artificial intelligence, decision support techniques to achieve a smart and interconnected healthcare delivery system. So this phase also envisioned proactive treatment, disease prediction and prevention, and more personalized medicine. And of course, AI helped through all of this. Next slide, please. So now comes the last phase of industrial revolution and healthcare revolution. So while this figure depicts that how the industry 5.0 is revolutionizing across domains, we have smart supply chain systems, we have smart education, we have smart hospitals, we have data which is directly stored in the cloud environment. There are smart production management units. So all these smart manufacturing facilities, they secure their data, they are designed to secure their files in the cloud. Thus, and this all ensures efficient resource utilization across locations. So similarly, the healthcare also integrated itself with the evolution of the industries. So the healthcare 5.0 focused more on health information, on connecting individual resources and organization. It is all about intelligent handling of health and environmental demands. So again, a lot of new technologies came into being, which are greatly helping in utilizing this, such as, fog computing, cloud computing, 5G technology, Internet of Medical Things. And Healthcare 5.0 also encompasses aspects which include smart disease control and detection. It also includes virtual care, smart health management, monitoring, decision making, and advancements in medical science. The adoption of emerging digital technologies has been crucial, especially in the face of challenges such as the COVID-19 pandemic that we all have went through. Next slide, please. So while we have discussed these advancements, they have led to a change in consumer behavior as well. So, before COVID-19, we always had this stigma, that we have to go to see a doctor in person. There has to be a physical meeting between a doctor and patient, or any kind of advice if we had to seek. But the pandemic really shifted the way, we were looking at healthcare. It has shifted the way how we were talking to our doctors, and it has also shifted our minds that we can actually speak to our doctor, or, our physiotherapist, our gynecologist, anyone. We can consult with them online. So COVID-19 gave that necessary push, it actually forced people to use more and more digital tools to see the doctors. So with advancements in health technology, there were advancements in remote care. So now we also see that the patients today are okay with seeing a doctor online. They are no more stigmatized by that. So we can also see that there is a significant increase in willingness to receive remote care at home after the pandemic. And this is also true for chronic conditions. And there is literature present that shows that significant proportion of patients, that is nearly 66.5%, they have expressed their willingness that they're actually ready to see a doctor remotely from their home at a convenience, at as per their own convenience. So next slide, please. So the transformation towards digital platform in healthcare is, it is fundamentally reshaping the contemporary patient experience. Today's patients are increasingly connected and empowered by, a wide variety of digital tools and platforms that provides them insights into their health. For example, we have gadgets like smartwatches, or there are certain apps which can now enable us to have a real-time access into our critical health data. And this also allows the patients to be more proactively participating in their good health, in their well-being. So the influx of technological innovations is not only revolutionizing how patients engage with their own health, but also how they, interact with their providers, also their healthcare providers. So through virtual consultations and through telemedicine-based solutions, doctors can now connect with patients regardless of their geographical barriers, thus fostering a greater access and convenience in delivering the healthcare. Moreover, digital evolution is also it is driving a paradigm shift towards a fully digitized healthcare ecosystem. As patients become more accustomed to personalized digital experiences, traditional healthcare models are being reimagined, to prioritize seamless integration of technology into every aspect of patient care. From scheduling appointments to accessing medical records, the entire patient journey is undergoing a digital makeover now. So this in turn enhances, the patient engagement, the patient satisfaction, along with the health outcomes. Next slide, please. So it is very important for healthcare organizations today to understand the behavior of today's consumer. So consumer behavior in healthcare, it refers to the decision-making processes and actions that individuals take for their health, including, what are the choices that they're looking up for seeking medical advices, for seeking healthcare providers' advices, or even for adhering to their treatment or their lifestyle choices. Next slide, please. So, as the healthcare transitions to digital platforms, patients are more engaged in managing their health. So, availability of user-friendly online interface and interactive tools, they all empower individuals to actively participate in monitoring and tracking their health metrics. And patients can easily access their medical records, and they can track their progress, they can communicate with their healthcare providers, which in turn fosters a sense of ownership as well as accountability in their healthcare management journey. For increased adherence also, digital tools play a crucial role because, we have apps such as medication tracking apps, the dosage reminders can help the patients, in order to say track on their healthcare routines, which ultimately improves their health outcomes and certainly reduces the risks of complications. Then for timely interventions also, patients can quickly reach out to their healthcare providers through messaging platforms or through virtual consultations, and thus leading to their enhanced health. For informed decision making also, the patients or the individuals who are accessing this, they have access to comprehensive health information which empowers them to make informed decision about their health. So digital platforms offer a wealth of resources, of evidence-based information, research articles. They can also get personalized health insights, and this all enables the patients to gain a deeper understanding of their conditions, and they can also access if there are other treatment options available. This in turn also reduces the patient's stress, anxiety levels. If the interfaces are user friendly, there are clear communication channels, and they can access the support as per their convenience. So it all fosters a sense of comfort. There's a reassurance for patients that they can navigate their healthcare journey with with a greater ease. So as for providing continuity of care, seamless online services ensure, that there is uninterrupted and consistent delivery of care across various points. And there are integrated platforms, there are interoperable systems. So patient information, so that, patient information can flow seamlessly between healthcare providers across geographies, and thus facilitating coordinated care and reducing the risk of fragmented experiences. So that is all from my side. I think from here, my colleague, Dr. Rinsa Waheed, will take over the presentation. Sonia, over to you.
Thank you, Dr. Harpreet, for your lovely presentation. Now we will move on to another second speaker, that is Dr. Rinsa Wahid. I'll just give a brief about her and her experience. She worked as a course coordinator and point of contact for Kerala University of Health Sciences Digital Health Certificate course. She has furthermore served as a lecturer at Global Institute of Public Health in Kerala for Masters in Public Health program. And she is also one of the co-faculty for digital health course that Empower School of Health recently launched. Now I would like to give floor to Dr. Rinsa. Rinsa, over to you for your presentation. Thank you. Dr. Rinsa, we cannot hear you. Are you there? You're on mute.
Hello, am I audible now?
Yes, we can hear you.
Okay, yeah. Please let me share my video also.
Host, can you give rights to Dr. Rinsa? Vinita and or Bharat, can you? Yeah, now you'll be able to turn on your camera.
Okay, yeah. Thank you so much. So thank you, Dr. Harpreet. Thank you, Sonia. So I welcome you all to the webinar once again. On this upcoming slides, we will look into some of the groundbreaking technological advancements in healthcare. Let's move on to next slide. Next slide, please. Yeah. Artificial intelligence in healthcare. It's commonly known as AI, and it is a technology that enables computers to think, learn, and make decisions, very similar to how human brain works. AI combines computer science and data set for problem solving. AI algorithm creates expert systems for prediction and classification and use data to create algorithm that can drive automation. The field of AI includes machine learning and deep learning. AI is transforming the healthcare industry by enhancing diagnostic accuracy, personalizing treatment plans, and improving patient care by analyzing medical data. Implementing AI in clinical settings require a well-planned strategy. The key steps include identifying areas of improvement like diagnostics or patient management. AI has several key branches, which include machine learning, natural language processing, computer visions, robotics, predictive analytics, and deep learning. Each branch plays a vital role in transforming healthcare, offering innovative solutions for diagnostics, treatments, and enhancing patient experience. In future, AI is expected to revolutionize industry by enabling more advanced automation, predictive analysis, personalized customer experience, and breakthrough in fields like healthcare, finance, and transportation. Please move on to next slide. Next slide. Next slide. Scope of AI in healthcare. Artificial intelligence in healthcare refers to use of complex algorithm and software to emulate human cognition in the analysis, interpretation, and comprehension of complicated medical and healthcare data. The significance of AI is evolving in today's healthcare settings as it has profound impact on enhancing patient care, improving diagnostic accuracy, and optimizing healthcare operations. They enable personalized plans by considering each patient's unique health profile, thus improving treatment outcomes. In administrative domains, AI is streamlining processes, reducing waiting time, reducing cost, and improving the process of clinical research and drug development. AI-powered tools such as chatbots and virtual health assistants are revolutionizing patient engagement and care accessibility, making healthcare more responsive and patient-centric. Now, let's look at the benefits of AI in healthcare. Please move on to next slide. AI-driven systems have immense advantages in healthcare system today as they augment human experience and they can analyze vast amount of medical data to identify patterns and correlations for personalized treatment plan. They can also be instrumental in enhancing the diagnostic accuracy because AI is able to study large data set in very short amount of time. AI has huge and significant potential to change how healthcare is given today. And if we continue working on AI-driven applications, we'll see what future healthcare will look like. Now let's look at the future applications of AI. Next slide, please. So recently, we saw a charged ChatGPT, which really changed the way how content was being looked at. So these LLMs like ChatGPT 4 have potential to transform patient interaction through intelligent chatbots, providing instant personalized medical advice and support. LLMs will also enhance medical research and drug development by rapidly analyzing the vast volume of scientific literatures and data leading to faster breakthroughs. Next is machine learning. It is a branch of AI which can imitate the way humans learn data and make use of data around them. Machine learning algorithms can find relations and patterns between healthcare data to make predictions. They can be used in clinical research to allow for efficient identification of patterns. They can be used in clinical decision making so that they can look at the medical records and give informed clinical decisions supports which can reduce human error. Next is generative AI. Generative AI is another buzzword that we all are hearing nowadays. It can really change the way we diagnose and give treatment to patients. Generative AI can create data after learning the properties of medical data. Here, the artificially generated patient data has the perspective to revolutionize clinical research and help in the protection of patient privacy. It has the potential to reduce the administrative burden or clinicians by auto-masking tasks such as writing referral letters, clinical codings, and consultations. Let's move to next slide. Let's discuss about big data. Big data is usually used to express enormous amount of data which are too big and hard to deal with by traditional database. This data is characterized by huge volume of data with different variety, velocity, and veracity. The significance of big data-driven technology in healthcare is profound as it is opening new avenues for medical research, personalized treatment, and health system management. Big data in healthcare enables the analysis of vast health information, leading to disease prediction and personalized treatment. Big data analytics significantly impacts healthcare by providing deep insight into patient care, disease pattern, and treatment outcome, leading to more informed and effective healthcare decision. In healthcare, big data analytics utilizes technologies like machine learning, cloud computing, and predictive modeling to analyze vast amount of health data for improved patient outcome and healthcare efficiency. Current challenges in adopting big data analytics in healthcare include concerns over data privacy and security. There's a need for specialized skill and the integration of diverse data sources into existing healthcare. Ensuring the successful implementation of big data in healthcare settings requires robust data governance, investments in interoperable technology, and continuous training for healthcare professionals. Let's move on to next slide. Now look at the, let's see the overview of what are the different benefits of implementing big data into current health system. So big data facilitates predictive analytics. It enables forecasting outbreaks, diseases, and also for individuals, it can help us predict unwanted or emergency health incidents before they occur. Personalized medicine. When system can work over patient data over time, the doctor are able to create and curate treatment plan which is tailored to a specific need of the patient. Cost reduction. By optimizing healthcare delivery, by reducing redundancy by big data analytics, healthcare organizations can really reduce their cost. Operational efficiency. Data-driven decision-making can streamline clinical operations. Role of research and development. It can play a significant role in research and drug development because it has the ability to review and understand large amount of data set. Enhance patient outcome. It can help in risk management and it can also help in fraud detection because its ability to review thousands and thousands of data sets and analyze patterns, and also it analyzes the trends. Risk management. Big data helps in identifying and managing potential health risk of group of population. Fraud detection, it can also pick up anomalies and frauds in health data sets. Let's move to next slide. Bioprinting in healthcare. Bioprinting is additive manufacturing technology that utilizes a digital file as a blueprint to print objects layer by layer. Unlike traditional 3D printing, bioprinter uses cells and biomaterials to produce organs-like structure that allows living cells to proliferate. Initially, bioprinting focused on simple structures like skin, tissues, and basic organ models for research purposes. Because bioprinting is a complex mechanism, it needs precise technology with accurate replication of human tissue structures. It's also very difficult to maintain cell viability during the printing process. We also require advanced bioinks, which need an optimal environment to replicate human body conditions, and current bioink formulations sometimes struggle to provide the necessary nutrition and structural support that is required to sustain a tissue in an organ. Move on to next slide. Process of bioprinting. There are 3 stages: pre-bioprinting, bioprinting, and post-bioprinting. In pre-bioprinting stage, anatomically accurate 3D models are created using computer graphics and converted into stack of 2D layers with user-definable thickness before being fed into bioprinters for printing. The material or bioink selection is an integral part of this step, and digital files often based on MRI and CT scan are generated to enable the printer to interpret the data. Next is bioprinting. In this step, it involves the actual printing of tissue by additive manufacturing techniques. Depending on the structure, researchers load the self-filled bioink into cartridge and select one or more print heads. Post-bioprinting, this is the final stage of bioprinting process which provides stability to the printed structure. Most structures requires cross-linking to achieve complete stability. Cross-linking is typically accomplished by exposing the constructs to either an iconic solutions or UV lights. Next slide, please. So now let's look at the latest innovations and trends in bioprinting. The stem cell technology. Stem cells can create 3D structures by building layers of materials accurately. Bioprinting, especially stem cell technology, can be really promising for creating better disease models and organs. They use mesenchymal stem cells and cultured meats for enhancing the quality of bioprinted tissues. Microfluids. It enables the creation of intricate structures with high accuracy, and they can open up bioprinting to a range of bioinks. This technique can provide high detailed constructs with precise geometric and controlled micro environment, which can be really essential for a fully functional and implantable organs. Nanoengineering. Nanotechnology can make bioinks more biocompatible with improved functionalities. Overall, nanoengineering and bioprinting delivers safe drug system and reduce healthcare expenditure of transplantation materials for healthcare. Next slide, please. Now let's discuss about blockchain. Blockchain technology is an advanced database mechanism that allows transparent information sharing within a network. A blockchain is distributed a list of transactions that is constantly being updated and reviewed. It can enhance healthcare by providing secure and tamper-proof storage of medical records, ensuring data integrity and patient privacy. It also facilitates seamless and transparent sharing of health information among different stakeholders, improving efficiency and coordination in digital health system. The adoption of blockchain technology in mainstream clinical setting faces several challenges. The challenges are technology's nature, healthcare industry's complexity, and various regulatory and practical considerations. Next slide, please. How does blockchain works? A blockchain can be simply broken down into 2 components, a block and a chain. As the name suggests, block is a collection of data that is linked to other blocks with a chain. You can think of it as a train with each train consists of multiple carriages, and each carries a certain amount of data. Just like the passengers in real life train and carriages block, it can fit only into a certain amount of data before they are fully flight. Next slide, please. How does a blockchain technology works? A blockchain technology starts when a user requests for transaction. A block representing that transaction is created. The block is then broadcasted into a network of nodes. All the nodes validate the block and transactions. And once the block is validated, it gets added to a chain and then the transactions gets verified and executed. Next slide, please. 5G services. So 5G or fifth generation mobile network, it is a global wireless standard network, and it can enable a new kind of network that is designed to connect virtually with everyone and everything together, including machine, objects, and devices. With high speed, superior reliability, and negligible latency, 5G will expand the mobile ecosystem into new realms. 5G will impact every industry, making safer transportation, remote healthcare, and digitized logistics. 5G technology can revolutionize healthcare by enabling faster, more reliable telemedicine and real-time data transfer, significantly improving patient care and outcome. Faster and more reliable data transfers enables real-time transmission of large amount of data, including high resolution of images and videos. It can also help in achieving predictive, preventive, personalized, and participatory healthcare services that people expect today. Implementing 5G services faces challenges like high cost of infrastructure, concern over network security and privacy, and ensuring consistent coverage in remote areas. Next slide, please. Significance of 5G services, they are mainly bringing advantages by enhancing mobile broadband. They provide ultra reliable, low latency communication, and they can allow for massive machine type communication. So compared to previous cellular generations, 5G today is better suited for healthcare use cases that require high data rates across a wide area of coverage. That means remote area and cities which do not have a good internet connectivity to be connected virtually to a hospital or a healthcare providers. And it can remove the latency requirement and can support many devices at one given time. Next slide, please. So from this given image, let's see how 5G connectivity can improve the sharing of data across different drivers of healthcare ecosystem. It's important that for an effective and personalized treatment plan, it is important that all the stakeholders, hospitals, care teams, allied health workers, all have the access to real-time patient data, which can be possible with 5G technologies. So if healthcare professionals have access to real-time patient monitoring, they can monitor patients' chronic condition. They can monitor patients better when they have discharged from hospital, which can reduce fewer days in the hospital and can also reduce readmission in the hospital and can increase chronic care management for healthcare professionals. If there is access to high-speed internet connectivity, they can get access to patient record in less amount of time, and they are able to see more patients. So their operations become more efficient. For healthcare organizations and hospitals, 5G internet connectivity can increase higher patient output and can also decrease the waiting time. And for government and private and public sectors, if authorities can have access to real-time data and data of disease, prevalence of health status of population, it can help government to make informed population health decision and can also get increased insight into epidemiology of disease in particular segments of population. Next slide, please. 5G enabled remote healthcare case. Remote patient monitoring means that the healthcare provider is able to monitor a patient's health status remotely with exchange of data between device and doctor with 5G technology. With a reliable and secure internet, the transmission of health data from the patient to the doctor become more secure and faster. And and which means the doctor are able to monitor the patient more effectively in real time. Connected ambulance, lower latency. 5G can transfer data and video instantly to hospitals and clinic through the ambulance, so that they can, when the patient arrives at the emergency department, the doctor and the care team can already have certain informations, which means they will not waste any time in treating the patient. 5G enabled services also provide virtual remote consultation, which is very useful for patient under palliative care. Next slide, please. Innovations and trends of 5G services. 5G services along with AR and VR assistance can be used for a blind. Like here, everyday tasks like reading an internet site or crossing a street can be made easier for those with lower vision or even without it by employing a set of video screen devices or an augmented reality or virtual reality assisted headgears with 5G capability. Similarly, it can be used for distraction and rehabilitation therapy, especially for pain management in pediatric cases. 5G services have proven its ability to be used in remote surgery with collaboration of experts and other doctors. 5G services along with AR and VR assistance can be utilized in training and education, which we'll discuss in the upcoming slides. Let's move on to next slide. Robotics in healthcare. Robotics is a branch of technology that involves the design, construction, development, and operation and application of robots which are programmed machine capable of performing a variety of tasks autonomously or semi-autonomously. Robotics are poised to transform healthcare by enhancing surgical procedures, by automating a lot of those tasks which are performed by doctors and nurses today. So AR technology is bridging the gap between theoretical knowledge and practical application, offering a more immersive and effective approach to both medical training and patient care. Integrating robot into healthcare system poses challenges due to the need for significant investment in infrastructure and training for staff to effectively use and maintain the advanced technologies. We need to develop a comprehensive guidelines for ensuring these robots can seamlessly interact with existing healthcare system, and protocols with compromising patient care adds another layer of complexity. Move on to next slide, please. So let's discuss on the application of robotics in healthcare. First, on robotic surgery. They are supervised by surgeons, but they are used to give more stable, clean alternative to human surgical interventions. These technologies help in enhanced precision and control during operations. Pharmacy automation. They can provide automation in drug development process and supply chain. It also reduces medication error and improves patient safety. Sanitation and disinfections. Robot can be used for sanitation in the hospitals and theater rooms with no risk on their own life. Rehabilitation robotics. It can be exoskeletons that can aid in mobility and physical therapy. Telepresence of remote consultation. We can have robot present in terms of physical robots or for teleconsultation. Assistive robots. This is one of the best use of robots in allowing vulnerable population or old people or people with disabilities to have some companion that can live with them and can also provide them aid in doing their daily activities. Next slide, please.
Dr. Insa, sorry to interrupt you in between. We are already shortened on time, so can you please? Yeah.
Yeah, okay. Sure. Can you move on to slide number 42? Next one. We'll just discuss about 1 or 2 points. Yeah. So virtual reality, here it is a computer generated environment with scenes and objects that appear to be real, making the user feel they are immersed in their surrounding. And the key components include, it has a head mount display and a monitor tracking sensors. So this VR technology in healthcare, it can give us an opportunity in holographic surgeries, and it can also do molecular level training, providing personalized healthcare assistance. It can help in neurological disorders and can give patient a fully immersive telehealth experience. Move on to next slide, please. Augmented reality. Next one. Next one. Next one. So next is augmented reality. This is an integration of digital information with the user environment in real time. And it has an interactive experience that enhances the real world with computer generative precognitions information. So in virtual reality, it can be used. Integrating augmented reality into traditional healthcare is kind of challenging due to high cost, data security, and regulation concerns. So compatibility issues with existing system and need of training in healthcare professionals is important. Please move on to next slide. Conclusion. Next one. Next one, please. So digital transformation in healthcare has incorporated several digital innovation which pave the way for the following, like change in consumer behavior. Digital platforms have provided the provision of health information, telemedicine, and personalized health tools to individuals, hence alternating consumer behavior and encouraging proactive participation in self-managing of health. When it comes to remote patient monitoring, modern wearables and networked sensor provide real-time health data and remote patient monitoring. This has lowered the need for a repeated hospital visit and enhanced patient care by enabling early action. In case of improved patient and caregiver experience, the healthcare experience is being transformed by telehealth enhanced communication. So electronic health records are one of the examples of a digital technology that improve the patient-centered care and give carers more effective coordination. When it comes to community health and wellness, through encouraging participation, sharing health information, and supporting preventive care programs, digital technology improve the community health through the creation of interconnected networks and mobile applications. In summary, like integrating digital technologies not only transform the way healthcare is delivered, but it has also given people more control, enhance patient care, and promote the health and welfare of community. Accept the revolutionary possibilities of digital solutions for a more connected, healthier future. That's all about digital health innovation. Thank you all. Over to you, Shruti.
Thank you, Dr. Rinsa. Thank you for your presentation. Now further to connecting, because since the presentation is already over, I basically would like to briefly inform audience about the courses that has been offered by Empower School of Health. We have 3 courses under postgraduate diploma, and since today's webinar is related to health, digital health, so we have a course postgraduate diploma in digital health. For more information, please visit our website. The link has been posted on the chat box. Also, I would request attendees to please put your questions on the chat box if they have, because we are already shortened in time. So our speaker will try to cover those questions. In addition to postgraduate diploma, there are long-term courses, that is Masters of Science in Global Health Procurement Supply Chain, that is for 24-month course. And this is in collaboration with Unital that we are offering. We also have few short courses. Everything is mentioned on the website. Please do visit our website. For each and every course, we have some partial scholarship that we generally allow, provide audience and the people who are interested for partial scholarship. In order to apply for this program, please write to us on operations@empowerschoolofhealth.org, and also you can get the contact details from the website. Now this is time to launch poll 2, and after this we will be going forward for Q&A session for 5 minutes, and then we will close the session. Thank you all. So I would request hosts to please launch poll 2. I hope everyone can see it. I can see people, those are just putting it on the chat box that they are not able to see the poll. I hope they'll be able to do so. So there are basic questions about, this is basically a feedback poll. This will help us to improve in the future webinars. And also I can see the people are interested for the slide deck. As I mentioned, for some security reason and integrity issue, we cannot share the slide deck of the speakers. But yes, the webinar recording will be available on YouTube website. So you can check the content from there. The certificate will be shared with all post-webinar within 24 to 48 hours. So I would request attendees to please participate in this poll, and after this we will be moving forward to the Q&A session. So there are very basic question. Was this information useful? I can see 97% as of now. They are mentioning yes. Are you interested in exploring any digital health course? 96% says yes. So as I mentioned, we already have a course in digital health. So please visit our website. Which course training are you interested? So there are people who are interested in data management. So we will be launching data management course soon in a week time. So that will also is already available on the website. So you can fill up your pre-enrollment form over there. For digital health, the course is already live. So you can fill up the application form and the relevant team will get connected with you. For short courses, yes, we have almost over 10 short courses, which is available on website. Postgraduate diploma, as I mentioned, it's already there. So you just need to select this respective course that you're interested in and the relevant team will get connected with you. So now I would request backend team to please end poll 2 and we will move on to Q&A session. Over to you, speakers, for Q&A session. And audience, please put your questions on the chat box if you would like to ask anything from the speakers. Thank you.
Thank you, Sonia. So all I can see is the comments. However, there is one of the question which says that I want to know how digital technology will ensure confidentiality and privacy in delivering services. So the answer to this is, data can be shared in encrypted format. The way you see or enter data will not be visible to someone else. This is how data is encrypted. It will be not in a readable format or in a comprehensible format. Then, further it can be done through, doing an access control. Not everyone can have access to data. You can also mask the data. There is data anonymity, which can be practiced. And, there are secure, data sharing, or there are secure channels for sharing data, which is very confidential. So that is how you can maintain the confidentiality of the data. And it is very important because, patient data is of significant importance. You cannot just share data with anyone.
Along with that, I would like to add, it is important for the healthcare professionals to stay updated on the latest advancement, and it also continuously improve, security measures and address evolving threats. We'll be updated about the latest technologies. Yeah. Thank you. Dr. Harpreet, you're on mute.
I think that, sorry for that. But the digital health is a continuously advancing field. So whatever is relevant in present context may not be relevant, down 2 years or 3 years. So you have to be continuously updated with what is going on with this. And, there are country-specific guidelines that needs to be adhered to. So there is also a question by Karuna that if dispensing of medication becomes automated, will this function not affect the importance of pharmacist? So Karuna, the importance of pharmacist will be always there. Dispensing of medication, the automation processes are done for your convenience. You have to be there, a primary person responsible for monitoring and all that always has to be there. So we have to be wary of the fact that digitization is there to support us in our functions, not take away our functions.